Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Every year, more than 500,000 Americans experience that first heart attack and join nearly 26 million at risk of getting another heart attack. And those who are in accordance with gold standard clinical guidelines may be prescribed daily aspirin therapy to help prevent recurrent heart attacks. But this presents another treatment challenge. Our guest in studio today is Dr. Lori Mosca, 2015 American Heart Association Physician of the Year and a leading researcher in preventive cardiology. She's in studio today with us to talk about some of these issues with daily aspirin therapy and how some of it can cause some gastrointestinal issues that maybe you can avoid. How are you doing, Dr. Mosca?
Oh, very well, and thank you so much for having me.
Yeah, I'm glad to have you back in studio with us. When we were here before, we were talking about some of the preventive measures that one can take in order to, prevent that first or even recurring heart attacks. We didn't talk about daily aspirin therapy. We see these commercials on television touting aspirin. Some of them, I guess, children's aspirin for some issues. Uh, some would think that taking an aspirin every day just because would kind of do something to the stomach. Is there information that you have that's contrary to that popular belief?
Well, I think you've already brought up some really good points about aspirin. First of all, it is the gold standard therapy for the secondary prevention of
Hmm.
heart disease. And you alluded to some other situations where there may be much more room for discussion between the healthcare provider and the patient.
Hmm.
But when it comes to secondary prevention, there really is no debate that unless there's a contraindication, that aspirin is a very evidence-based approach to prevent recurrent disease. Now, what you brought up, Neal, is the reality of the situation, which is that many patients who are taking aspirin therapy to prevent recurrent disease have side effects, gastrointestinal side
Mm.
effects. In fact, when you look at clinical trials of aspirin therapy, 1 in 20 patients had GI side effects.
One.
And, this is a real concern because
Mhm.
it often leads to discontinuation.
So someone's on daily aspirin therapy, and it seems you say it's evidence based. How exactly does the aspirin work to prevent that heart attack? And then once someone's rolling with that and everything's okay, suddenly having to come off of it, where does that leave the patient?
Well, it's so funny. It was aspirin as a chemo preventive agent was discovered in 400 BC by Hippocrates, who prescribed it really as an
Hmm.
anti-inflammatory
Hmm.
to relieve pain and fever. And we know that recurrent heart disease is often caused by a thrombotic event and also an inflammatory milieu. So the anti-platelet effects and the anti-inflammatory effects may be very important in how aspirin prevents recurrent disease. But the flip side of it is that aspirin is also can be very upsetting to the stomach, and the most common side effect associated with why patients discontinue their aspirin therapy is the GI side effects. And very concerning because we know that discontinuation of aspirin in this setting is associated with a threefold increase in major coronary events,
Wow.
and it happens very quickly within 11 days, and that's likely due again to the sort of the clotting
Hmm.
milieu and the inflammatory milieu.
What about some of the other anti-inflammatory agents that are out there? I mean, once aspirin proves to be, a little bit disruptive, aren't there other avenues that you can go that maybe mimic aspirin?
Well, there are other agents that may have some of the therapeutic benefits of aspirin, but they don't substitute for
Ah.
aspirin. I mean, aspirin is really the gold therapy
Hmm.
for preventing heart disease. There are, of course, we have statin therapy. We have a whole litany of agents, but there's really nothing that substitutes for aspirin therapy. So we need to keep that in mind. And of course, the concern that I alluded to about our highest risk patients that are most likely to develop an event in the future. If they stop their aspirin therapy they can triple their risk of having another major coronary event. And if, unfortunately, if they've already had problems with GI bleeding, that risk can be increased sevenfold. So we've got to address the reality of trying to achieve the benefits of aspirin therapy and try to minimize the side effects of therapy. And we have ways to do that, but surprisingly, Neal, physicians are not aware of this, especially among my colleagues in cardiology.
You know, it would seem that your colleagues would be at the forefront of knowing about some of these developments. Is it always a matter of complete discontinuing of therapy, or do you say take half doses, and if that doesn't work over a period of time, or can you discontinue and then maybe go back with a different dosage, or is it always, hey, you know, once it's done, it's done? And maybe talk about baby aspirin.
Okay, well, let's talk about that because actually this is a really good point. And again, cardiologists who are most likely to prescribe aspirin therapy for the benefits, because we live sort of in a siloed world in medicine and academia, often aren't aware of what's going on with the GI symptoms and innovations. And so we need to understand that discontinuing therapy increases risk, yet we have ways to approach that. You brought up some of them. And let me clarify some of these myths, because I was a believer in these myths as well, that if we took really low dose aspirin, we wouldn't be at risk of bleeding. Not true. There's an increased risk of bleeding across all doses of aspirin therapy, number one. I used to believe, like many of my colleagues, and you alluded to, watching commercials about this, buffered aspirin, enteric-coated aspirin.
Absolutely.
Do these protect us? Answer, no. There's an increased risk of bleeding regardless of the type of coating that we have. And that's why cardiologists and primary care physicians, nurse practitioners, individuals that are prescribing, recommending aspirin therapy for the secondary prevention of heart disease need to be aware of new innovations that we have available. Now, the proton pump inhibitors, many of us are aware of. We've used them short term for gastric distress, but we haven't really thought about these long term in conjunction with aspirin therapy. And one of the reasons I'm really excited now is because of the launch and availability now of a new medication that's available for our patients that was just approved by the FDA called Yosprala, which combines aspirin therapy with a proton pump inhibitor so that you can sort of maximize the benefits of the aspirin and minimize the GI side effects and thus increase adherence to the aspirin therapy.
Being aware about the lack of knowledge of some of these developments among your colleagues, in your opinion, what do you think is the, I guess, number one contributing factor to preventing your colleagues from having this widespread or much more knowledge about some of these things?
Well, I do think the paradigm is changing now, where there's a lot more crosstalk, and I think that's a really great development in medicine in general. I said that we lived in a siloed world, but I think these barriers are now beginning to be broken down, and I think that's a really good thing because we can't have blinders and only look at the prevention of heart disease. We have to understand that our patients care about their symptoms. They worry about side effects. We know that fear of side effects is a big deterrent to patients taking our recommendations seriously. And that's a particular challenge with aspirin because in the past, aspirin has really been available only over the counter. I worry sometimes that patients don't take it seriously enough. And now with a new prescription form of aspirin in conjunction with a PPI, I think this provides a really new opportunity for us to revisit how important it is to take aspirin, how important it is as healthcare providers that we monitor the side effects and monitor adherence. Critically important and something that we've not always been taught to do or not integrated into our practice.
I'd like to ask you a question about, in your opinion, the importance of not only being able to talk to the patient, getting honest answers about some of these side effects, because, if you're the cardiologist and they're having a stomach problem, they may be a little reluctant to talk to you and say, well, this guy knows my heart, but he doesn't know my stomach or my intestines. How important is it to understand the symptoms as well as how to, treat them and address them, or is it simply a matter of recognizing them and then referring them to a gastroenterologist?
Well, I think both are important, and
Mm.
I don't actually think it's necessary in a preventive setting
Okay.
to refer to a gastroenterologist. Certainly, if somebody had a bleed or is having anemia or
Hmm.
symptoms, that would be a situation where we would refer our patients. But I think as we get more comfortable with this new paradigm where we're really trying, if we look at it as a way to really maximize the benefit of something we're doing to prevent the heart, and we don't really need to learn that much more. I mean, I
Hmm.
think, it's pretty easy for most of us to understand, the pharmacology around using an agent like Yosprala, where
Hmm.
basically what you're doing is you're releasing the omeprazole, the component that's protecting the stomach lining. That's an immediate release component,
Okay.
gets the gastric pH to where we want it, then boom, the aspirin comes in the delayed release. We have less symptoms, greater adherence. It's a win-win.
Lori, it's been a pleasure having you in studio with us today. I'm glad that you stepped in and gave us some more of your time.
Sure, my pleasure. Thank you.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Lori Mosca. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.